Hello there, lovely couples. Today, we're going to talk about a question that might have crossed your mind. Is pregnancy a pre-existing condition? It's an important topic, especially for those of you who are planning to start a family soon. Doctors closely monitor women during pregnancy, which leads to most expecting mothers visiting their OB-GYN about 15 times over the course of a full-term pregnancy. Health insurance covers most of these visits, as well as prenatal tests, ultrasounds, delivery, postpartum care, and newborn care. Pregnant women can't be denied health insurance for being pregnant under the Affordable Care Act, ACA, in USA. But a pregnancy doesn't automatically require that insurers cover you. You still must be eligible to buy coverage, such as during an open enrollment period. First, let's clarify what a pre-existing condition is. It's a term used in the health insurance industry to describe any health issue that existed before your insurance coverage started. These could range from chronic illnesses like diabetes to physical conditions like a broken leg. Now back to the main question. Is pregnancy considered a pre-existing condition? The short answer is no. Thanks to the Affordable Care Act in USA, pregnancy cannot be considered a pre-existing condition by insurance companies. This means they can't deny you coverage or charge you more just because you're pregnant. The next question we usually come across is, can we get health insurance while pregnant? You're allowed to purchase health insurance at any point during pregnancy as long as you're eligible to buy coverage at that time. Women can't be denied health insurance or charged more for coverage due to pregnancy. You can typically only buy health insurance coverage during an open enrollment period. For Affordable Care Act, ACA, plans, open enrollment is every year from November 1 to January 15 in most states. Employers set their own open enrollment periods. A pregnancy doesn't automatically start a special enrollment period in most states, so you want to be sure you have already purchased health insurance before you become pregnant. You'll be eligible for a special enrollment period once the child is born, but by then it will be too late to cover childbirth bills. There are 3 ways to get health insurance for pregnant women during an open enrollment period. Enroll in an ACA plan through the health insurance marketplace. Get a health plan through your employer. Buy individual health insurance directly from a health insurance company. There is a way to get health insurance without an open enrollment period, but many Americans don't qualify. Medicaid and the Children's Health Insurance Program, CHIP, let you sign up for coverage whenever you're eligible. You're eligible based on your household income, and that varies by state. However, it's important to note that if you're planning to get pregnant, it's advisable to secure health insurance beforehand. This is because while pregnancy itself isn't a pre-existing condition, any complications arising from it could potentially be considered as such. So the ACA law does not allow health insurance companies to consider pregnancy a pre-existing health condition. If you enroll in a health insurance plan during pregnancy, health insurance companies can't refuse to insure you, and insurance companies can't charge you higher health insurance premiums for being pregnant. This rule also applies to newborns and newly adopted children. If your baby is born with a medical condition and you enroll them in an ACA health insurance plan within 30 days, they can't be denied coverage due to their pre-existing condition. All medical insurance plans purchased on the health insurance marketplace provide essential benefits for pregnancy, delivery, and postpartum care, including newborn care. Below are some of the pregnancy-related services that health insurance covers. Pregnancy costs covered are routine doctor visits, ultrasounds, prenatal vitamins including folic acid, lab testing, blood work, screenings for pregnancy-related conditions, and smoking cessation programs. Delivery costs covered are vaginal or cesarean birth, hospitalization, epidurals, and other forms of pain management and medication for labor induction. Postpartum costs covered are newborn care including early screenings and vaccines, breastfeeding equipment and support, lactation consulting, and birth control. But remember that each insurance company and policy is different. It's always a good idea to thoroughly review your policy and even speak with an insurance representative to understand what is and isn't covered. While pregnancy is not a pre-existing condition, it's crucial to have health insurance in place before you plan to start a family. This way, you can ensure that you and your future little one are covered, no matter what. Thanks for joining us today, and we wish you all the best in your family planning journey. Please support us by share, and subscribing us.